Hello, I'm Louise Minchin. Welcome to Menopause, Misinformation and Management, a programme by the British Menopause Society and ITN Business for World Menopause Day. Around 13 million people are currently peri or menopausal in the UK. People are talking more openly about menopause, but there is still a lot of misinformation. I'm joined now by Dr Paula Briggs, consultant in sexual and reproductive health and British Menopause Society chair, along with Haitham Hamoda, consultant gynaecologist and immediate past chair. Thank you both. The menopause is being discussed much more openly about. There are so many conversations. How can people be sure they get trusted information?
Well, I think it's great that women and men are talking more about menopause, and it's becoming more normalised, but I think there is a lot of misinformation out there and it's overwhelming for women. Lots of people will access information on social media which is not regulated, and we would encourage women to seek information from a reputable resource such as Women's Health Concern, which is the patient-facing arm of the British Menopause Society. And I think naturally, women will talk to friends and family about menopause, but that doesn't necessarily mean that they get the right information. So having somewhere that they can go where information has been reviewed by lots of different clinicians, I think is reassuring for them. And I think, accessing information on social media can actually be quite frightening for women. So just normalising menopause, knowing that there's treatment there if you need it, I think is very reassuring.
We know there are lots of different types of treatment. How do people choose what is right for them, and also managing risks as well?
I think it's all about really individualization is really important. So it's really looking at the individual and looking at what symptoms a woman is experiencing, what are the problems that she's experiencing through this process, understanding what it involves and how it can affect an individual. That's really important. Within the process of awareness, it's really important to make women aware that the presentation is really varied. So some women can go through the menopause, about 25% without having symptoms. 25% can experience what they would describe severe symptoms, and 50% somewhere in between. So we need that awareness of saying what you may expect with this process is important, how long these symptoms may last, which on average is about 7 years, but some it may be much shorter, and for some it may be much longer. So that expectation aspect and management of it is important.
Tell me also about the positive outcomes. Are there benefits?
Yeah, there's definitely benefits, and I totally echo what Haitham said about individualised care. So I think what women are looking for is a quick fix often, but a menopause consultation is so much more than that. I think lifestyle interventions for everyone are really important. But not only will women see resolution in symptoms if they have the right treatment, which for most women HRT is a really beneficial treatment if they're eligible, but there are other things which can make such a big difference, optimising blood pressure, optimising weight to reduce the risk of type 2 diabetes, and maintaining bone density, reducing cardiovascular risk, but it's always part of a package. It's not just about giving women HRT.
How about younger women and perhaps other family members as well? Do you think they need to have more information to stop being fearful about all of this?
I think awareness is key to this whole process. There's so much talk about the menopause, which is great and very welcome, but it's also important that women are aware of it before they hit that stage. So it's knowing what the menopause involves, what impacts it may have, and how you can handle them. And of course, there's a question of when is the right time to do it. So the British Menopause Society has campaigned for a women awareness information at 40. But of course, there's also the talk about having it at a much earlier stage. So you could talk about awareness at school. And this is, you could say, applies to younger women, but also to men as well. So for people to be aware what can happen, what happens through this process, how it affects them, and what to expect in it. Because otherwise you may be in a situation where you'll be thinking, when the menopause is going to come, I'm going to be in a difficult place and this is going to affect me in a bad way. So awareness for what may happen if they experience the menopause at the normal age, but also relevant to mention that a significant, albeit small proportion of women may experience menopause at a younger age. So it's really important that they know what impact it has, and to give them advice from a general health advice about fertility or fertility control if needed, and symptom management in that respect.
So education and information. Thank you both very much, Paula Briggs and Haitham Hamoda. Thank you.